Hello everyone, I'm Dr. Tiffany, a specialist in plastic and cosmetic surgery. Today, I will be sharing with you how to take care of yourself after fat grafting in the eye area. If you don't know the proper aftercare or want to achieve the best results, make sure to watch my entire video. After fat grafting in the eye area, swelling will occur. At this time, you should apply a cold compress. As you can see here in my hand, this is a cold pack. However, we do not place this pack directly on the eye area. Instead, we use a thin piece of gauze to wrap around it, and then we apply it to the eye area. For other cosmetic surgery procedures around the eyes, we can apply the cold pack directly onto the wound. However, for fat grafting procedures, doctors do not recommend pressing on the area where the fat was injected because it can affect the survival of the fat. Instead, we should apply the cold pack to the areas around the eye socket, not directly on the grafted fat area. When applying a cold compress, we should do it for 15 to 20 minutes at a time, and you can repeat the process every 2 to 3 hours. For fat grafting procedures around the eyes, doctors do not recommend applying warm compresses because if we cannot control the temperature, it can cause the fat tissue to break down and reduce the survival rate of the fat cells. For cleaning the eye area, we should use saline solution to gently clean the wounds and then apply a layer of ointment. First, this is to keep the wound moisturized. Second, it is for antibacterial purposes. And please note that after applying the second layer, you must thoroughly clean off the first layer beforehand. Because I often see my clients layering 2 or 3 coats continuously, which then forms a film and results in an unsightly scar. And during this stage, we should avoid letting the wounds come into contact with water or any kind of soap. That's why doctors recommend that you wipe your face instead of washing it with facial cleanser as you normally would, and the same goes for washing your hair. You should tilt your head back or go to a salon to have your hair washed to avoid soap or dirty water getting on your wounds. And during this period, you should not apply any products unless you have your doctor's approval. When resting, you should keep your head elevated and avoid strenuous activities such as going to the gym or climbing stairs, especially for those who have high blood pressure, and for activities such as sexual intercourse, we should also limit these during this period and make sure to get 7 to 8 hours of sleep each day. For those of you who work in an office, you should also avoid straining your eyes, take breaks, and not overwork yourself. And during the initial stage, we should also avoid sudden weight loss. Because when we lose weight, our body fat decreases, and the fat that we have grafted into the eye area will also decrease accordingly. You should also avoid foods that are spicy or oily, as well as carbonated or alcoholic drinks. Instead, we should consume foods rich in protein and vitamins. Drink enough water to help your wounds heal faster. We should avoid touching the eye area, do not massage or undergo any cosmetic treatments around the eyes during this period, and do not wear contact lenses. As for makeup, you can start wearing makeup again 2 to 3 days after the stitches are removed once your wounds have fully healed. When going outside, you should wear a hat, sunglasses, and apply sunscreen. Because when your wound is still fresh, it is very susceptible to sun exposure, which can easily lead to dark spots and scarring. Finally, remember to take your medication as prescribed and return for your follow-up appointments on time. So I've just shared with you how to take care of the eye area after fat grafting. If you have any questions or concerns, please leave a comment below and the doctor will help answer your queries. For now, goodbye and see you in the next video.